So let's talk about gas toxicity during diving from manual professional edition. We will talk about different types of gases. Oxygen, there will be oxygen toxicity, nitrogen necrosis because it's like hallucinating and is like a drunk person. Carbon dioxide, carbon monoxide, uh, that can cause symptoms. Now, it also is divided to physiological and non-physiological gases. So oxygen toxicity can cause when the partial pressure of oxygen is high and the patient has dived to a very deep meters above 57 meters. What can be done is to use different gases and not use, for example, 100% oxygen in diving. We need to exceed this atmosphere to get to what we think is. Remember that it can cause complication even though it is oxygen. So symptoms is mainly CNS symptoms uh, like paresthesia, seizure, vertigo, nausea, vomiting, and seizure can happen, syncope can happen. The meaning of this is that patient can draw. Now, nitrogen can also cause complications. It's like a drunk person. Again, when you dive too deep, there can be a complication. Nitrogen necrosis is like alcohol intoxication and impaired judgment. The patient, because of this, can draw. Hallucination, loss of consciousness. It depends on how deep you dive. The deeper you dive, of course, the higher the complications. Now, it's quite rapidly self-limited, but you can also give him oxygen and things like this when he ascends. To prevent this, you can use different gas mixture, for example, with helium to prevent the nitrogen necrosis. Yet, using this, the helium-oxygen mixture, increase the risk of high-pressure neurologic syndrome, which we'll see here, which is quite poor understood syndrome with many CNS uh, complications, and nitrogen can be used to prevent it. Now, you prevent nitrogen necrosis with using helium, but it can cause high pressure neurologic syndrome. And to prevent this, you add nitrogen. So it's like comes and goes. You go to this direction, you go to that direction. Okay, carbon dioxide poisoning. If there is no respiratory effort like hypoventilation, deep diving, contamination from exhaled gas. For example, the patient exhales and instead of non-rebreather mask, the exhaling gas goes to the mask and the patient or the diver breathe it again. So if there is something like this, hypoventilation, the diver doesn't uh, breathe. So it can cause again complications, CNS like headache, vertigo, seizures, loss of consciousness. Okay. Now it's usually resolved when the patient ascend, so arterial blood gas won't really help us. Carbon monoxide, it is quite a complication. Maybe the somehow the engine is near the mask or something, and then it can get to the breathing system, and it can cause carbon monoxide poisoning, seizures, syncope, coma. In severe cases, you can use a carboxyhemoglobin to evaluate it. Remember that saturation pulse oximetry readings are not reliable because it cannot differentiate between carbon monoxide and oxygen. So it's not reliable, the pulse oximetry. It usually will be normal. You should give 100% oxygen. It's better with non-rebreather mask. It reduces the half-life of carboxyhemoglobin, which is the hemoglobin that is connected to CO, carbon monoxide. You can see how better it is in removing the carbon monoxide. It reduced the half-life of carboxyhemoglobin from 4 to 6 hours to 30 to 150. Sometimes also hyperbaric oxygen therapy is used. It's a little bit controversial, but when there is severe cases like carbon monoxide greater than 25%, it can be used, it should be considered, but it is controversial, and you should know that carboxyhemoglobin will drop more rapidly. You can see the half-life will be 15 to 30 minutes compared to only oxygen 100%, which is 30 to 150 minutes, compared to just normal air, which is 4 to 6 hours time for half-life or carboxyhemoglobin. Now that here you can see the controversial in using it. Okay, high pressure neurologic syndrome is not really understood very well. It happens in deep diving, especially when divers are compressed rapidly. It can cause again neurological symptoms, neuromuscular symptoms. You can see here somnolence, myocardial jerks, vomiting, intellectual problems, eventually usually accompanied by slowing rate of compression and using nitrogen gas uh, and incorporating it in the breathing mix of gases. So we talked about oxygen toxicity, nitrogen necrosis, carbon dioxide toxicity, and carbon monoxide toxicity. And in the end, we talked about high pressure neurologic syndrome in diving, gas diving, or gas poisoning in diving. Thank you very much. If there are any mistakes or corrections, please correct me. And that's it. I think that's it.